Welcome, my friends, to Dharma for Doctors, Spiritual Care for Caregivers. I am your host, Greg Holden. Joining me today is Daly, the Dharma dog. Daly is a corgi, and she is 10.5 years old. Daly knows a lot about spiritual care. She listens attentively, she is welcoming, and she's always willing to be with people. She certainly picks up the spirits of everyone who meets her. These talks are directed at anyone who cares for others and who is confronting the stress, the sadness, the joys, and danger of burnout that goes along with your role. You might be caring for family members at home. You might be a nursing home or hospital worker. I particularly want to talk to young doctors who work long and hard, doing stressful shifts, often with no one to talk to about what they're going through. Before I retired, I worked as a palliative care chaplain at Cook County Hospital in Chicago, one of the largest hospitals for the poor and uninsured in the United States. Residents who rotated with our service were assigned to spend a few hours with me. And one of the first things I talked about is this: what exactly is a chaplain? Most doctors know there are chaplains in their hospital. I imagine someone mentions this in passing as part of their orientation. Call the spiritual care department if someone is crying or needs someone to pray with them. But I don't know how much your attendings tell you about who to call on if you're upset or feeling burned out yourself. I think it's important for you to get a brief introduction to chaplains and what they can do, because they are here to help staff as well as patients and families. Speaking personally, when doctors had the courage to reach out to me to talk about losses they experienced themselves or illnesses they were dealing with, I was only too happy to help. I felt that much more that I was an integral part of my institution and that I was really needed by my own team members. All you have to do is ask. That, of course, applies if a patient is in the hospital needing someone to listen to them, or a family member of a patient needs support as well. There is a beautiful word for chaplain in the French language, aumônier. It is related to the Old English word almoner, which is someone who gives alms to the poor. I can't go around giving people money, but I can hand out tangible items. I have Bibles and rosaries. Here's a rosary with a prayer card attached. Here's a prayer card of Our Lady of Guadalupe, who is very significant to people from Mexico. And a prayer card of the Black Madonna, especially important to people from Eastern Europe. One of the best things about my experience in the hospital was that I was so frequently welcomed by patients who were tired of seeing teams of doctors asking the same questions and talking about this or that number or test or treatment. This only drove the patient's thoughts inward to their illness, to their uncertainty about the future, to the idea that I'm broken, I'm sick, this is serious. Chaplains work in environments populated by individuals with widely differing spiritual beliefs, or no beliefs at all. There is a chaplain in the U.S. Congress. There are chaplains in the armed forces and NASCAR, and even at Tyson Foods in Arkansas. It has always been one of my fantasies to have a hard hat like they have at Tyson, with the word chaplain printed on the side, by the way. Chaplains have a certifying body, the Association of Professional Chaplains, and they have an educational program. I myself started out as a volunteer chaplain in a hospice. Then I enrolled in one of the chaplain educational programs, this one at a local hospital, where I was an intern for several months. Then I was a resident for a year, and then I got a job as a hospice chaplain. Then I was hired by Cook County Hospital. After 2,000 work hours, I was able to appear before a board where I was certified as a professional chaplain. As part of their education, chaplains learn things like active listening, how to formulate a prayer, and how to engage in critical conversations. They also learn how to minister to people of many faith traditions. Most chaplains are lay people, but many are ordained ministers. Some are priests, some are rabbis, some are imams. The overwhelming majority follow a particular faith tradition. It must be said that chaplaincy is a primarily Christian field, although other faith traditions are getting greater representation as well. As for myself, I was raised Catholic. I was an altar boy at the time when Catholic masses were still said in Latin. And when I was in my teens, I went through a period of questioning. The more I learned about the Catholic Church and its history, the more I couldn't follow it. I stopped going to church, and for many years I had no spiritual path. Then the university where I was working invited a Tibetan Buddhist monk to give a talk. That's him depicted behind the microphone, by the way. His name was Gelek Rinpoche. The title of his talk was Overcoming Habitual Patterns. That made a lot of sense to me, so I joined his group, and I have been a Buddhist ever since. I don't go around advertising myself as a Buddhist chaplain. His Holiness the Dalai Lama teaches us to respect all religions and to not try to change anyone, so I don't usually bring this up. I meet people where they are. It's about them and not about me. By the same token, I'm not going to hammer you with Buddhist theory or Buddhist sayings or Buddhist this or that. But you might get a hint of Buddhism once in a while because that's what I know and that's what helps me. For instance, Dharma for Doctors doesn't mean this is going to be a Buddhist course by any means. Dharma in the original Sanskrit means the performance of one's duties in society according to one's role in society. I've also heard it described as self-knowledge. In the ancient text called the Bhagavad Gita, Krishna said, "It is better to do one's own dharma, even though imperfectly, than to do another's dharma, even though perfectly." My prayer book is stuffed with Bible verses, Psalms, Muslim prayers, Hindu verses, non-denominational poems. I recite the ones that have meaning to me. But most of the time I pray from my heart, just as my chaplain mentor, a Pentecostal Christian minister, encouraged me to do. At this point in my talk, if you were going around the hospital with me, seeing patients, I would ask you about your own spiritual tradition. Do you follow a particular faith, or none at all? If you want, tell me about yourself in the comments below. Do you have a favorite prayer you can suggest? I'm always looking for prayers. Or if you are not religious, how do you connect with spirit? Do you go hiking or mountain climbing or kayaking or gardening? I want to know. In other talks, I'll address how I minister to people who describe themselves as spiritual but not religious, or non-religious, or agnostic. Many young doctors describe themselves this way. It's all good. The important thing for you is to have a way to connect to the universe, to soothe yourself, to comfort yourself, to find meaning and purpose in what you do. All of this will help you deal with the stress and the tragedy you encounter in your job. So, how does knowing what chaplains do help you? First, you have a little better idea that chaplains exist in your institution. In fact, Medicare mandates that any institution that receives its money needs to provide spiritual support for all patients. Whether they actually provide adequate support for all is another question, but most hospitals do. And you know when to call the chaplain, not just when the patient asks, because that doesn't always happen. Call us when there are tears and sadness and someone needs support, or when someone is dying. For now, I'll leave it there. The bottom line is, A chaplain is a spiritual friend, and I want you to know that you have a spiritual friend here. If you are worn down, stressed out, overwhelmed, shell-shocked, I am here for you. So drop me a line or ask me a question, and I'll do my best to get back to you. Please subscribe and like this video if you are inclined. And by the way, any chaplains out there, feel free to add in the comments other things that chaplains do that I didn't have time to get to in this brief introduction. I send you blessings and I wish you peace. Again, I am your host, Chaplain Greg Holden, and this has been Dharma for Doctors, Spiritual Care for Caregivers.